Okay, so I would like to talk about COVID-19 and why we need a MyData approach. So as we speak, there is, of course, a health and sanitary emergency. And I think the science is coming through and showing some path out of this emergency. And the governments are starting to understand what should be done as a consequence and are adapting the laws in Europe as we speak. So there were different amendments, for instance, today in France. Some of them passed, some of them didn't, on the use of data coming from telecom operators or from geolocalization to help with COVID-19. Also the possibility of putting people forcibly into isolation if they were affected, for instance. A volunteer, an anonymous volunteer from Personal Data.io is currently mapping all of those initiatives around the world to change the laws in relation to COVID-19. So you will see here a list of decisions taken by different governments, obviously with a huge effect on civil liberties. So today I wanted to first concentrate on the science and deduce from that why there is really a need for a MyData solution. The first strategy that might come out of COVID-19 or that might be tried in relation to that disease is to mitigate it, to have everyone eventually, or most people eventually have it, to acquire herd immunity as a consequence, and to be able to protect more people who are more likely to be affected more severely by managing how many people go to emergency hospitals, need really deep medicine to save them. So there was a report from Imperial College trying to model all the different ways this could be done and all the different ways we might, oops.
The screen
Paul, unfortunately, we don't see you as changing the slide. So maybe you can just skip the presentation mode and show the slides from there. Maybe it works better this way.
So is it better now?
Yes, now I can see
mitigations.
So I think this has been discussed extensively, and maybe it's not worth delving too much into it. It's basically not going to work. Too many people will die. So the strategy is switching, and now the governments are switching to a different strategy, which I really want to explain because this is core of why MyData is the solution. Recent evidence from Oxford has shown that they've been trying to model based on the best data that we have from China and from Asia in general, which might not be all that relevant to Europe. We don't really know. They've been trying to model how the disease is being transferred. And these 4 colors there, this is to the best we know. The dark blue is symptomatic carriers who are transmitting the infection. The dark green is asymptomatic carriers transferring the infection. The light green is environmental factors, so touching surfaces, for instance. And the light blue is pre-symptomatic transfer. And they're trying to assess the contribution from each of them over time after the infection. The total area under the curve there is 2.0 in this graph. And this is the reproduction factor of the infection. How many people on average is an individual who is affected expected to infect? Right? If that number is above 2, or is above 1, sorry, then the growth is exponential and you have an epidemic. The goal is to intervene in such a way that we can reduce R to less than 1. If you look at the numbers, the pre-symptomatic and the symptomatic carriers numbers are huge. The only viable strategy to reduce the overall area under the curve seems to be to kind of try finding back in time who has been potentially infected and to test those people extensively. So to use the symptomatic carriers, those who start coughing essentially, to encourage them to do testing, and if they do testing and they test positive, to find back all the contacts they had in the past to try to figure out who might be a carrier from them. And to reduce basically the R from 2, as is modeled right now, or maybe a bit more, to R less than 1. Now, could this work? How could this work? Well, this is what's needed. It's in this graph. So the percentage of success in isolating cases versus the percentage of success in quarantining contacts. So it's basically how viral do we need the countermeasure, quarantine, to be? How successfully viral do we need it to be, right? So if you look at on the left, if we manage to have 20% success in isolating cases And we managed to quarantine out of that around 75%, but there is, of course, error margins, so between 55 and 85% of contacts. Then it seems like we could reduce the R factor to below 1. How are we going to do that? Well, the idea would be to do it through an app. This is the idea of these Oxford academics and of a few other people. If someone is asymptomatic, pre-symptomatic, and is spreading the disease on day 1, has an everyday life, then through an app, all their contacts are being traced, so that the next day when they have a fever, they can report that they have the symptoms. A test is sent to them, they test positive, and then their contacts are affected. Obviously, this would have an enormous impact on privacy. A lot of governments are trying to aggregate a ton of data from many different sources. So there is an enormous need for a solution that can be data-driven, but at the same time respect our civil liberties. And we know that MyData can be a solution for that. So if you understood this, or even if you didn't, I think you should join us on the mydata.org Slack on the channel Corona Data, because we're working on this, and there is going to be a prototype. There's already a prototype ready, but tomorrow it will be shared a bit more widely. So thank you, and sorry for being over time.